Hello there, welcome back to the European Parliament in Strasbourg for Talking Europe. I'm Catherine Nicholson. Now, today we're talking about healthcare, specifically cancer, an illness which in various forms claimed the lives of more than 1 million people across the European Union in the year 2020. Well, the European Commission projects that cancer cases will increase, and by more than 20% by the year 2035, unless quick and decisive action is taken. The Commission has launched a wide-ranging Beating Cancer strategy, which we will be discussing today with two members of the European Parliament who are also medical doctors. We have with me on my right from Germany and the European People's Party, Peter Liese. You're also a member of the Parliament's Special Committee on Beating Cancer, is that right?
Yes.
Thank you for joining us. And across from you, from Portugal, Manuel Pizarro of the Socialists and Democrats group here in the Parliament. Thanks for being with us.
It's a pleasure.
So I just want to start off then with a very general question to both of you. Peter Liese, I'll come to you first. Why this focus on this one specific disease, cancer, and why at an EU-wide level when individual member states look after their own healthcare?
Cancer is a huge problem for Europeans. I think all of us know somebody who died from cancer or is seriously affected by cancer. And we talked a lot with scientists and experts, and they said we can only beat cancer if we work together. This is in particular true for cancer in children. You know, I worked in pediatrics, and I know that cancer is rare in children, but when it affects the family, it's a huge problem. And like with other rare diseases, cancer in children and rare cancer also in adults can only be addressed if you have enough patients for clinical trials and if you have specialists for this typical cancer. And the big cancer, like lung cancer or breast cancer, is treated more individually now. We have modern technology to be more targeted with less side effects, but that makes the big numbers to small numbers. It's also rare. So we need cross-border cooperation to address this. And if we do it right, cancer can be a role model for much better cooperation in the health area in Europe.
Manuel Pizarro, same question to you. Why this focus, again, across the EU level? What would be the advantage of doing that?
First of all, cancer is a huge problem for all countries in Europe. As Peter has said, it is now the second cause of death, but it will be the leading cause of death in 15 years or something like that. And there are a lot of approaches that can be made at the European level. For instance, approaches in the prevention side, they should be organized at the European level to fight against tobacco, against the hazardous products like asbestos or other kinds of air pollution. And there are a lot of inequalities between European countries, not only in the screening for the disease, but also in the treatment of the disease. If we make an European global approach, as we have seen now in COVID crisis, we can do much better for all the Europeans, and mainly we can create a European Union for Health, as Mrs. van der Leyen stated in November 2020, and I think that the European Beating Cancer Plan can be a key pillar of this idea.
Well, there's a very specific budget for this Beating Cancer Plan, 4 billion euros earmarked for it. What do you make of that budget, Peter Liese? It is a lot of money in the absolute, but compared to, for example, in 2020, France nationally spent 200 billion euros on healthcare.
Yeah, I think it's very clear we cannot beat cancer if we don't cooperate in Europe and if Europe doesn't do its bit. But on the other hand, these figures show that we also need efforts by the national governments and by the regional governments. So everybody has to do its bit, and Europe has to concentrate on those areas where we need cross-border cooperation. So, for example, joint procurement of tests for all early detection. That is a good point where we can join forces like we did with the vaccine against COVID. Joint forces, and every European should have access to this equipment. Here, Europe can help, but there will be issues that the member states continue to have to deal with it.
If I may have Europeans' perspective, Europeans' approach as to the subsidiarity principle. We are not going to put out the national or the regional budgets. We must add to those budgets a support from European unions targeted to very specific measures that can make the difference. If we can use the best experiences of some European member states in the early screening of cancer to all the European member states, we are going to get a huge advantage in fighting against cancer. I think this is the idea of the European Beating Cancer Plan.
Well, if we look at what's in the plan, it covers prevention, screening, healthcare, aftercare aspects. I'm wondering how far 4 billion euros will go to help so many different parts of this mosaic.
It depends, because they have to the national budgets, and they can be even improved with the budget of some horizontal programs. For instance, Horizon Europe can be mobilized in a largest way to the innovative approach in cancer. All the budget related to the European health digital space can be added to that money. We must look at money as money is only one aspect of the problem. We can win a lot in a global approach, not depending directly of money.
Well, just picking up on what Manuel Pizarro said about Horizon Europe, that's an EU research programme. Peter Liese, in the latest EU budget negotiations, the member states, the heads of government, heads of state, said that they want cuts for this scientific research programme in the year 2022. Is there a conflict between what the Commission and Parliament want in terms of scientific research and what the heads of state are saying?
There definitely was a conflict, and I was in particular angry with the so-called Frugal Four that said we need to reduce the EU spending, even though Sebastian Kurz said in a meeting that if there is a priority for Europe, then it's research and innovation. And still they wanted to cut the budget. But the European Parliament didn't accept. We insisted on an increased budget for research. And we have a specific point where we already delivered on our fight against cancer. We will have a cancer mission. So one of the biggest priorities of EU research policy is the fight against cancer. And that is very, very important.
Manuel Pizarro, you who obviously support this cancer plan, do you think you can talk the heads of state and government round?
Yes, but you know, this is a bad perspective from some member states and from some member states leaders, because I fully agree. The idea of investing in research and development is central to the modern perspective of Europe. And we can profit from them in multivarious ways. For instance, we have used now to organize vaccination against COVID and to discover the vaccines against COVID, investigation that has been paid by the European Union against cancer, to find instruments against cancer. This global approach is essential if we want to deliver better care with less spending.
So a message to certain heads of state and government there, perhaps. Just specifically on one area that's flagged up, the plan talks about having a smoke-free generation by 2040. A quarter of EU citizens regularly smoke, but we already have more expensive cigarettes. We've got neutral packaging, those really big photos of illnesses you can get on the cigarette packages. Peter Liese, it feels like, is the only thing left to just ban cigarettes? How do we achieve a smoke-free generation?
Yeah, it's very clear that smoking is the most important cause of cancer. 50% of the cancer cases, we just don't know why they happen. But when we know the reason, cancer is number one by far. And then come other issues like obesity, lack of physical activity, alcohol, and then later on pollutants. They are all relevant, but tobacco is the most important.
A specific
cause.
link.
And that's why everybody should stop smoking, and young generation should not start smoking. It is very difficult. I have understood in the United Kingdom they are going to ban cigarettes. I don't know if that will work out, because people are just used to do it. But if somebody would introduce such a dangerous product like tobacco on the market in Europe, it couldn't be allowed under any regulation. For me, it's important to have two points. We need to prevent young people from start smoking, but we need to make it easier for people to quit smoking. That's why I am in favor of also using e-cigarettes. E-cigarettes are less harmful than normal cigarettes. The best would be nothing at all, but if people cannot quit without the e-cigarettes, we should allow this.
I think
Disagreement over here.
I think that we don't know enough about e-cigarettes. Of course, I can agree that they are less risky than tobacco, but there is a huge risk that in the long term they can conduct people to get the habit of smoking. Even mainly those young people that we want, we agree that they should be aware from the idea of smoking, they can be conducted to the habit, to the addiction of tobacco by using the e-cigarettes. So I think that we should have the same regulation, the same tax system on e-cigarettes than in the tobacco, and we should not allow to aromatize those products of tobacco.
All right, well, we'll have to wait and see if this smoke-free generation by 2040 is something that can be achieved. I'd like to thank you both very much for taking part in this discussion. Manuel Pizarro and Peter Lisa, thank you. Thanks to you for watching the programme as well. Do hope to see you very soon here on Talking Europe.